everybody.
This is a class, we do a class once a month on different subjects. This time is on functional blood sugar management. And this is Dr. Peck, Dr. Bauer, and I'm Dr. Bircher. And just wanted to go through that we, first of all, are certified by the state to be able to use nutritional therapy for people who have diabetes. And Dr. Peck is certified to manage medications for people with blood sugar issues and diabetes. And so what we want to do is describe the problem, offer solutions, and give you some ideas what you can do about it, and then we have something to offer at the end. So first of all, the problem. It's a growing problem. 25 million people in the U.S. have diabetes. And just a little bit about the statistics, it breaks it down a little bit. 40% of adults over 20 have diabetes or pre-diabetes. Okay, we can talk a little louder. That's a lot of people. And by pre-diabetes, it means that if you don't change lifestyle and diet, that people will end up with diabetes. 30% of the people over 60 already have it. And if the trends continue at the current rate of these numbers, by the year 2020, the estimate is 50% of the population will be pre-diabetic or diabetic. So it's a large problem. So just start off with some, real specific things that how it affects lots of different people in different ways. Diabetics, 75% have high blood pressure. Heart disease is higher. Blindness, people have heard about that. Kidney disease is very common. Amputated foots, you've heard of that. 30% higher risk of cancer, and also higher risk of nerve damage, including memory, dementia, and feeds into Alzheimer's in some cases. These are just some examples of just a pictorial of what we just talked about. What happens to the nervous system when people have diabetes is that the brain tends to shrink over time, and that's measurable by MRIs. Dementia, memory loss, people have heard of neuropathy, people can't feel their feet. So those are some of the most common things that happen with diabetics and the costs.
So the average person who is diabetic, on average, spends over $6,000 a year on basically a disease care situation. I only say disease care. What we're really talking about is medication expenses, doctor's visits, things of that nature. $194 billion in this country in 2010 was spent on diabetic care, and it's expected to top $3 trillion by 2020. This is, like Dr. Bircher said, a growing problem, something that isn't getting better because really our society isn't getting better. The way we do things and the way people are trained to eat, and also the way that people are taught to be able to manage this condition or be able to treat it more functionally. And that's what we're here to educate on.
We need you to speak louder if possible. Thank you.
Okay.
Well, some of the things with our diet, you can see that are listed here. We consume primarily carbohydrates, so starchy things that turn into sugar in our bloodstream really quickly, and fats. If the more carbohydrates that we take in, the more that our pancreas needs to put out insulin. And after a while, we just kind of run out of the ability to keep up with the demand.
So what happens is the pancreas eventually burns out because of refined carbohydrates and refined fats in our diet, because it has to work harder to digest both of those things. And so we talked about in the previous slide, the majority of diet is refined carbohydrates, and then 25% of it consists of commercial animal products, and most of those animals are raised on poor nutrient feeds, and there's hormones, antibiotics, and toxins, and that's been in the paper. There's a big, again, you'll hear in the news just in the last few weeks, there's another push to reduce the antibiotics in animal feed because it passes through to people and causes antibiotic-resistant bacteria. I think McDonald's just announced they were going to stop using chicken that was fed antibiotics. So there's stuff happening in our society because of this.
And we don't know what role that could potentially play in other things too, like irritable bowel. Maybe some people's intestines are all inflamed and in a turmoil because of all those antibiotics and hormones in the food that we eat. Right now, we just don't have any proof of that, but those are some of the theories that are out there that we're working with.
And the average person, 10% of their diet is vegetables and fruits, and most of that's potatoes.
Which is a starch.
And white potatoes basically have very little nutrition in them at all.
Right.
So just to get into a definition of what diabetes is, there's two types that are commonly talked about. One of them is called type 1, which is an autoimmune condition where the immune system actually attacks the cells of the pancreas that make insulin and basically destroys them so they can't produce insulin anymore. And for those folks, they're going to need to take insulin and control it for the rest of their lives. Type 2 is the body doesn't respond to insulin. The cells aren't responding. It's called a metabolic condition on the slides, or else also called metabolic syndrome, which is what most people have before they get full-blown diabetes. And we have a couple of references. This is a book that I really like. It's called The End of Diabetes by a medical doctor named Joel Furman, who does research in diabetes. And what he says in his book is that type 2 diabetes can be completely prevented and completely treated and gone if you do the right thing, which we're going to talk about those things tonight. Type 1 diabetes, he says, can be improved 50% by doing these same things, but they will still continue to have to take insulin the rest of their lives. And this is another book. So there's people who we know that have some research to prove that these things are true.
And their themes are fairly similar.
This is something I pulled out of the Eau Claire paper just a few weeks ago, and basically what the FDA is trying to do is just a few years ago they had to put labels on food, and you'll see a label that has how many calories are in it, how much of the calories come from fat, carbohydrates, and sugars, and there's a new law they're trying to put into effect. The FDA wants to put on the label how much of that sugar is added to the food. And the food industry is fighting back tooth and nail to prevent that from going into effect, because the food industry does not want people to know how much sugar is added to food. And they add they add sugar to almost all processed foods.
And that's where this article in National Geographic a couple months ago is just really interesting. It is phenomenal how much sugar we eat and how much sugar is added to all different kinds of things. Even if you read the label on a can of soup, I'll bet your bottom dollar that there's sugar in it. It's added to it.
And I think one of the statistics in there is like 140 pounds of sugar on average per year for Americans. That's a huge number because I don't eat hardly any, so somebody's eating a lot.
I don't eat hardly any either, so there's got to be more eating a lot.
That's right. And ultimately, sugar is an addictive substance, so I mean, there's a reason why they're adding that to the food, because, well, the reality is most people end up coming back to it because of that added sugar that's put into the food. They want to bring it back, just like somebody who's addicted to cigarettes or drugs or something, they keep going back to that same thing.
So here's an example of one of the first things I learned about when I studied nutritional science was how the food industry knows what triggers the brain to eat more. And one of the things is salt, and one of the things is sugar and fat. So the combination, and you'll find a lot of processed foods, they play with the combination of salt, fat, and sugar to get it to a place where you will eat more of it. And the potato chips is a good example. But the first example that I really looked into was the original McDonald's French fry. They used lard and infused the lard with sugar and salt, and then fried potatoes in that lard infused with sugar, and McDonald's became the biggest chain in the world off of their French fries and their hamburgers. And they figured out that formula and it worked. So that's just a simple example. Now McDonald's it's interesting, their business is going downhill, so they're coming out with some new ideas to try to bring their name back. One of them is to take antibiotics out of their food, which I don't think is gonna help them very much, but we'll see. Symptoms of diabetes. This is traditional diabetic symptoms: blurry vision, fatigue, weight loss, weight gain, hunger, thirst, slow healing wounds. People talk about wounds that don't heal in their legs, people who are diabetic. All of these things, most people have heard about. So there's just a little physiology to show in a picture form of how does the body metabolize sugar.
So essentially, when you eat, your body breaks down, everything that you eat is ultimately going to be either metabolized into sugar and be able to turn that into energy. Our body actually even has the ability to take protein and fat, and through a process called gluconeogenesis, we can actually convert that. Our bodies have the wisdom where the brain needs that glucose, the muscles, all that needs glucose. So that is the body's main source of energy, and we need to be able to have some of it. Okay, now move on. Ultimately, I think, I don't know if this is repetition for people, but we're just kind of going lowest common denominator here and just saying that, ultimately as the glucose comes into your system, the pancreas recognizes that and then releases a substance called insulin. And they have a little diagram here that the insulin is kind of like a key. The cells themselves are locked and will not actually absorb that sugar until insulin kind of opens up that door, or turns the key in the lock and opens that door to allow the glucose to be able to get into the cell. Moving on. So ultimately, many times, people are taking a look at their blood sugar, and what this is kind of getting an idea, or having the idea get across, is that your blood sugar isn't just a flat line. It's something that does rise and fall throughout the day, but that's why there is a range that people's blood sugar should fall within. We need to be somewhere healthy-wise, somewhere between 85 and 99 on a fasting blood sugar, and somewhere between 80 and 140 on a non-fasting blood sugar, in order for that to be considered within normal range. But ultimately, in situations with type 2 diabetics, what the problem is that either A, the cells themselves are insensitive to the insulin. It's kind of like, I would say it's kind of like a rusty lock, okay? And we need to have more insulin released into the system in order for the cells to be able to respond. The receptor, which the insulin combines with, there get to be fewer of them. I say it's kind of like a bee visiting a flower. If there's too many bees that end up visiting the flower, then the flower ends up kind of closing up its petals, and no more bees can visit that site. With insulin insensitivity in type 2 diabetics, there literally gets to be fewer of those receptor sites, because it's being bombarded with so much insulin in the system due to the starch and glucose, or I should say refined sugar consumption.
Or sometimes too, that receptor site that the key is supposed to go into, if the key or the site is rusty, you can't get the key in, or you can get it in but it won't turn, so the insulin doesn't work.
Right.
And one of the reasons that happens is that every cell in your body has a cell wall around it. And that cell wall is made from a two-layer, it's called a bilipid layer. There's 2 layers of thin layer of fat around the cell. And that's how the cell wall holds the contents in, which are water, and there's water outside the cell. So the cell has to have a membrane around it that holds water in. So it's made from fat. So what happens, earlier we talked about what are most people eating? Refined fats, poor quality hydrogenated fats that they talk about in the news. And if those fats make up your cell wall receptors, those receptors for insulin are poor quality. If you're eating poor quality fat, like French fries that are, you know, high heated in hydrogenated oil, then those cell wall makeup is poor quality and the insulin receptors are poor quality. So that's just an example
Just
of how it
doesn't
gets, how it gets that way.
Well, these are the ways that we might diagnose diabetes. There's several different ways that we can look at it. One of them is with a fasting blood sugar. That gives the values here of what we would look at for where those levels should be. Go ahead, we're in the
And
next
so
one.
one of the things that some of the statistics I gave earlier was diabetes and pre-diabetes. So here's the definition of what those words actually mean in blood sugar levels. So normal less than 100, pre-diabetes 100, 125, over 125 people, officially diagnosis of diabetes.
Is that fasting or non-fasting?
That's a
That's
fasting,
fasting.
that's fasting at that
Mhm.
point.
Thank you.
Good
Or having not
clarification.
eaten.
For 12 hours, I think is the standard.
Yeah. So for these danger signs, then, if the blood sugar levels become really high, and that's going to vary some with each individual. For most people, though, it's when it gets in the 300s or higher, that we develop something called diabetic ketoacidosis. In this situation, the body's actually trying to metabolize some of the fat in order to get what's needed because it can't get the sugar into the cells. It just isn't going to go there. The symptoms that a person like that would have would be some of the shortness of breath. Their breath smells like nail polish remover or really fruity, just a really sickeningly sweet, fruity smell. They might have pain in their stomach, some vomiting, dehydration, and they can even become very critically ill and in a coma until we can get that blood sugar corrected and back down into a more normal range for them.
So these are just a list of things that people who are overweight have a tendency to have more commonly get type 2 diabetes. Older, inactive is definitely a part of it because our bodies, when they're balanced, we burn energy and your body's designed to take in fuel, metabolize that fuel slowly and burn it off slowly by doing some activity. So what's happening now is instead of eating let's say a carrot that has carbohydrates in it, but those carbohydrates are complex. There's, let's say, 20 pieces of carbon to make up one piece of a carrot, and your body takes one piece off at a time, which turns into sugar, and this might take 2 hours. So the carrot breaks down into carbohydrates, into sugars, but it does it slowly, and if your body is burning that carbohydrate, turning into sugar, at the same rate, then the blood sugar stays the same, our physiology works well. It's not stressful. But if you eat something like a refined carbohydrate, white bread, white rice, then those
Donuts.
carbohydrates get turned into sugar very quickly, so the blood sugar spikes, dumps
Right.
insulin in,
It short circuits.
and then
Kinda.
insulin has two jobs. Drive the sugar into the cell. If the cell doesn't want any, insulin's other job is to store that excess carbohydrates literally within minutes, and it turns it into fat. And ideally, if your body was working perfectly, your metabolism was efficient, what would happen is that, let's say you ate a meal and complex carbohydrates, and you might have a few simple carbohydrates in there. Your body goes, okay, I can store a little bit of sugar as glycogen in the muscles, and if I need to, I can store a little bit of fat over here. And then as this meal gets burned up, it can take that fat out of storage and turn it into sugar and burn that in the cells so you don't gain weight from it. So your body's metabolism is efficient, and you eat the right amount of calories, it can handle a little bit of fat, a little bit of, different kinds of carbohydrates, and still be healthy, produce enough energy. But again, that's a balanced body, balanced metabolism, and a balanced meal. And we're gonna get into what that is in a minute.
And you probably see that happening in small children. If you give small children too much sugar, they just get really hyper because their body is, coping. It's like quick adapting, kicking in, burning off that energy so it gets rid of it, all that extra sugar that they have. But if we get a little bit older and we've got patterns of our behavior where we're not exercising, we're not doing those things, kids glued to video games, we lose that adaptive ability of the body. So it turns into fat.
And what Dr. Bircher was describing, I don't know how many people here maybe are diabetic or have diabetic issues, but what he was kind of describing is how quickly the cells come into the bloodstream. That's an example of what's called a glycemic index, and maybe some people who are familiar with that, but it gives a number ranking as to how quickly the sugar creates an insulin response. White bread has an extremely high number, it's like right around 100 white sugar, whereas, and there's can be even differences in potatoes, like white potatoes are around the 80 to 90 range, and red potatoes are more like around 40 to 50, so differences in that. There can be differences in the different types of foods that you eat.
And the glycemic index is in these books, and you can
Yep.
also find it on the internet.
You can find it on the internet, right?
So you can actually find out which foods have the most quickly effect in raising blood sugar.
But moving on, is everybody here familiar with what's called the hemoglobin A1C? Do people know what that is? Yeah.
Or
So-
glycosylated hemoglobin, they might call
Glycosylated
it.
hemoglobin, so this is kind of this is a pretty accurate description. The A1C is the blood test with a memory. You know, the way I've described it to patients is a fasting blood sugar is kind of like a snapshot or a photograph of, it's a frozen moment in time, just like a photograph is. And I always say to people, well, if I took a picture of you and said that you spent all your entire time in my office, well, that would be inaccurate. You do a lot of other different things, just like the blood sugar goes up and down, it fluctuates. However, the A1C is something that's more like a movie. It has action, and it tells us through the absorption of sugar into this particular protein how high the blood sugar has been on average over the course of several months. So if somebody has been having higher blood sugars on average, you may check them, and I've seen this many times, where somebody comes in and we do a blood test, and their fasting blood glucose is 94, which looks really good. But then we do an A1C, and their A1C is 6.7 or something like that, something high. So we caught them on a day where their blood glucose, the fasting glucose, was good that day. But when we look at the A1C, it tells a different story. We just caught them on a good day, but on average, they've been running higher blood sugars, and so that can tell us another piece of the puzzle, and that's why the test itself is run.
This is just a scale of what the measurement of A1C on the bottom, if it's 7% like he was talking about, and you look at the top, what that means is that if it's at 7%, then on average, that person's blood sugar for the last 3 months has been 170, which is way too high.
Right.
If your average blood sugar is 170, I can guarantee you your insulin's at high, and you're starting to turn that into fat. So ideally, hemoglobin A1C is 5.2. And there's research that shows that anything above 5.2 is directly related to brain shrinkage. And when your nervous system, the main fuel for your brain is oxygen and sugar, and so that's the main fuel source, and so it's dependent on that. And if the brain has too much sugar thrown at it, then it will cause it to shrink, and it will reduce function. So these are targets for, these are ideals. Fasting, 80 to 90, and like he was talking about, a couple hours after you eat, you should have blood sugar that goes up, maybe 140 or so, and by bedtime it should be coming down. And we do a test here at the office where we have somebody come in, we do a finger stick, take their blood sugar, we have them drink a certain amount of carbohydrates, and they go off, go shopping, an hour later come back and check it again, and then 2 hours later come back and check it again. And we find how the body responds to sugar by doing that test.
Exactly.
The other thing that's talked about commonly is people with low blood sugar.
What we're called hypoglycemia, and that is kind of the other side of the coin, where people are having blood sugar drops. And what I would say consistently is that hypoglycemia is a precursor to people then developing the hyperglycemia and diabetes. Most people who we talk to and who we've taken care of who already have diabetes or we're caring for with diabetes, those people experienced hypoglycemia previous to that. So if we can do things to help to deal with the hypoglycemia, we can actually move them further away from becoming diabetic. But essentially, hypoglycemia is a sign of glucose dysregulation. It's just on the other side where the blood sugar is dropping down too low to the point where people don't have enough fuel for their brain to operate. Common symptoms, as you can see, headache, sweating, impaired vision, dizziness, fast heart rate, hunger, shaking. And if you look at this and you have an understanding of the human body, what you see here is that really the majority of these symptoms are an engagement of the sympathetic nervous system. The sympathetic nervous system is the fight or flight system. Your body is going, oh my gosh, what's going on here? And the adrenal glands are actually kicking in to try to access some other sources of glucose from the system, typically, like Dr. Bircher was saying, from the muscles or from storage in the liver or in fat. And because it's a kind of more of a shock situation, there's some overshoot, and you get these other symptoms that go along with that, because the brain literally is in distress. So the sympathetic nervous system kicks in, and we start to sweat, fast heart rate, all these other things. Okay. So what are some solutions here? What we typically recommend with people who are either A, trying to take more of a preventive approach, or some people who may have a family history or already know that they are in that pre-diabetic range. Maybe some of you have gone to your medical physician and been diagnosed. You know, what we typically do is we start with some standard testing. We look at a hemoglobin A1C. We want to see what that situation looks like. The way I always tell it to patients is we really don't know how far we've come unless we find out where we're starting. So we have to set some baselines for where things are at. Now, an insulin challenge, that was the test Dr. Bircher was describing there, where we're talking about checking your fasting blood sugar, then having you consume a certain amount of carbohydrate, checking it directly after that, and then a couple of hours after to see, A, how your blood sugar is behaving. We're typically also looking at how much insulin is released in the system at the same time, so we can get a little bit more of a functional approach of what your body is actually doing in response to glucose, rather than just guessing. A lipid panel. A lipid panel is done because most people who end up having diabetes, I just looked at a blood report earlier before I left for vacation, and the patient had high blood sugar numbers, but almost always they have high cholesterol, high triglycerides, things of that nature, some indications that the body is actively taking that sugar that's not getting into the cells and converting it into fat. C-reactive protein. That's a test some people are familiar with, some people are not, but C-reactive protein is a marker for inflammation. It's an inflammatory marker, and sugar, as wonderful as it is, and as necessary as it is, when it's in too high a levels in our system, I tell people it's like liquid fire circulating around in your veins. It inflames the veins and inflames the blood vessels, and that's some of the reason why people actually end up getting to the point where they get amputations and things of that nature, because that inflammation created by the glucose ends up shriveling up those small vessels, so that those tissues furthest from the point of extremities, typically fingers, toes, feet, and the brain, they don't get blood supply, because those vessels die from the inflammation of the sugar. So we look at the C-reactive protein to see what overall inflammation is in the body, because that can be a good marker to determine whether or not somebody is responding to therapy and to care, because that C-reactive protein starts to go down. Okay? Fasting blood sugar. And then we also do some micronutrient testing. Why do we do this? The reason we do it is because it is very well known that zinc, vitamin B, chromium, vitamin D are all nutrients that are necessary for